So like I said, so we have, I want to say this brand, this TENA brand, they really do try to, their specialty is real. They really do try with incontinence care. If you have these pull-ups on, they don't have tabs. You're like, what do? I need to take them off my loved one in a real quick. Guess what? I'm not going to do it because I'm going to use this one, but you can rip it. It just rips right off. And when I help put this on my mom, I give it a little pull up the backside, and it really does hold. As you can tell, it's not ripping. I help get that up her backside, and it's really great. But yeah, if you have to get this off a loved one, especially if they're asleep or laying in bed, you can rip it on the sides, and then that way you can easily roll your loved one side to side to be able to get it out from underneath them, so that you don't have to worry about just taking it off like regular underwear. Hi everyone, I'm Lexie Callies. Do you feel the squeeze of caring for an elderly loved one and school-aged children? Then welcome to the Sandwich Stories. Let's dig in. Hiya! Hi everybody, it's Lexie Callies with Sandwich Stories. I am going to be talking to you about some of the products I found that work great for my mom and what they are, how I put them together, where you can find them. I think it'll be a little bit educational, and I'm hoping that if these items work great for my mom, hopefully they will work great for your loved one too. Okay? So, my mom, with her MSAP, like I've said before, the autonomic system starts to atrophy. Autonomic system, just as a recap, covers everything your body does automatically without you thinking about it. Breathing, blood pressure, digestion, sweat, saliva, tears, urination, bowel movements, all of those things that you don't think about that your body does until they don't work. So, I've said before, my mom has an issue with blood pressure. She really doesn't sweat that much anymore. So, of course, she can overheat very quickly. So, I have to watch about high heats. But sadly for my mom, it also affects her urination and bladder. We do treat her medically with Botox injections, which, yes, you can do. It will help with frequency, urgency, muscle spasms, those kinds of things. It really does help. She started off with 100 units almost 3 years ago. She's been doing it for quite a while. And now she's up to 200 units, which is the max amount. It still works. She does it every 4 months. We go to the urologist here at UT Southwestern, and her urologist was actually part of the clinical trials and studies. So he has done thousands of these injections. He knows what he's doing. He's so kind and so sweet to my mom. He's the best bedside manner. Thank you, Dr. Lamack at UT Southwestern. I don't know what we would do without you. But she still needs some help throughout the day and at night. So we use pull-ups during the day and also at night. And I just wanted to show you over the years what we have found works best for her. We've tried all the brands, all the name brands, everything you see on TV, which might work for some people. They're okay. But they just weren't cutting it for my mom. And so after some trial and error, this is what I found. So I'm going to show you some things we've got. So when it comes to pull-ups, this is the brand of pull-up that I love and use. It's the brand is called TENA, and she wears this one all day long, regardless. Even though it says it's overnight, we still use this one all day long. It's comfortable, it's soft, it does absorb a lot, and so that is very helpful. But we have also found that sometimes she needs a little extra help on top of just this. So then we add in these. These are a newer thing for her. We've been doing them for about a year now, and they are little booster pads we add inside of her pull-ups, and they just give a little extra coverage and I'm going to show you what they look like. Kind of tell you what they feel like just so you kind of know. And I have found this combination is a winner when it comes to my mom. Okay. I've even used it overnight on vacation and on travel, and it has worked really well too. So I'm going to show you how I do this. So one thing I don't think people realize is that when you take a pull-up out of the package, they are very compressed because, they have to be able to ship a lot and use the most space they can. And so when you take a pull-up for your loved one out of the package, don't just take it out of the package and put it on your loved one. They've been squished, they've been compressed, and you need to kind of open them up a little bit to get them to work the best. So when it comes to my mom and I put together her pull-ups, so it will come out of the package. As you can see, it's compressed. This is the front, this is the back. And so, see, it kind of hangs and it's kind of all stuck together. So you have to pull it open, stretch it out, open it up a little bit. So I do this with every single one as I'm about to put them together. I even turn them upside down. I give it a little stretch. So now it's really open. Nothing is stuck. And so then I turn it inside out. And this is what it looks like inside out. Okay. So on these, I don't know if you can see. Let's see if we can get this up for y'all. So there is a little blue stripe here. Blue in our family means back. This is the back side of the pull-up. And then you can see on the inside so this is what it's going to look like on the inside. Okay. So blue means back. That's a good tell for my mom to know how to put it on if she's having problems, because it is designed to fit like underwear. So as you can see, it kind of goes up in the front. So you want to know what the front side is and what the back side is. So it goes on your loved one properly and it does its job properly. So I turn it inside out. Okay. It's really soft on the inside. You can kind of see, I don't know if we can, it's got a lot of padding. It's very fluffy, but not over fluffy that you feel like it's just a lot of stuff in between your legs. You don't want that. That's not comfortable. Your loved one doesn't want that. So it's narrow and then it gets wider. And then as it goes down the back, it gets wider again. So that's how you kind of know what is the front and what is the back. So my mom used to wear these just by themselves. And then, like I've said, as she's kind of progressed with her disease, we've had to add in a few, the booster pad and a few other things just so that she has the dignity and they go up and down just like underwear. So when she goes to the restroom, if she's gotten to the restroom on time, she can go to the restroom, pull them back up just like underwear. But if she's needed the protection, she has it, and she has the dignity that nobody would know that she needed the protection. So that is key. Dignity for our loved ones is the number one thing. Trying to make sure that they live a life with dignity, because they do have pride and we want to let them have that pride as long as possible. So there's that. So once I've turned it inside out, this is what the booster pad looks like when it comes out of this package. Okay, so yes, again, it is compressed. They're tight in there. There are 20 in this packet, and there are 12 in this packet in this size. I believe if you get a smaller size, then you might get a few more inside the packet. But for my mother, it's 12 pull-ups in a packet. So we do always have more pads than pull-ups, but that's okay. So I keep all of these things on auto ship at my house. And so I always need a few more pull-ups than I do pads. And so I just adjust the auto ship for each item. So I take the pad out of the packet and then I open it up. You take this little cover off. You don't need this. It goes in the garbage. Then you open it up. Look at that. See? It's nice. It's big and long. This is the top. This is the front. And as it gets wider, it goes down the back side. just like the pull-up, it's narrow at the top and it gets wider down the backside. So this is also very soft, very cottony. It's thin. It's not bulky, but this holds, as it says on here, it adds up to 4 cups of absorbency for to your pull-up. So you can really overnight, this is the best because then maybe your loved one doesn't have to be changed as much because it's pulling the extra liquid away and making sure that they can be comfortable for as long as possible. Sleep is really important with a lot of these patients because it can really affect the rest of their day. If they didn't have a good night's sleep because they were having to get up and be changed and all these other things throughout the night, it just really affects their sleep. I mean, I don't want to get up and use the restroom myself, but to have people come in and help you change or have to get up because you don't have the right protection, then it just really affects your sleep, which then affects your health, which then affects how your day goes, and it just spirals down. So here we go. Add, pull up, right? So here we go. We're going to put it together. There is a sticky, as you can see, there is a sticky tab here in the back. So I'm going to pull that off. There it is. I'm going to put that to the side and then I'm going to put it in, I'm going to put this in the pull up. So yet again, this is the top. This is the top. This is the front. This is also the top. So I'm going to take it, I'm going to match it up here at the top, and I'm going to push it down throughout the pull-up all the way to the back. So now you can see it's in the back of the pull-up. So you can see there, it's there, nice, but look, you can't really tell that it is not part of this pull-up. I have had people at my mom's facility see me put these together and they had no clue that the pull-ups didn't come like this. They thought that they all came like this. They had no clue that I put them together for my mom. They were shocked. They said, I thought these were just special pull-ups with an extra pad. No, they're not. I'm doing it, but this just gives it. And so as you can tell, so now it's all put together. I turned it right side out. So here we go. This is what we have. So it's yet again still not bulky. Yes, it has a little bit of bulk, but it needs to do a job, right? So, that's okay. And this has a lot of stretch. And so it comes up very high. It goes all the way up up to my mom's natural waist. So it's nice and gives a lot of coverage. And then it's you really don't notice it under their clothes. That's the other thing. Trying to find something that looks smooth and just seamless under your loved one's clothes is really important too. Ladies, we don't love having panty lines, and your parents don't love having panty lines either. So finding pull-ups too that just fit smoothly and flat under your loved one's clothes I feel is really important. Yet again, dignity. We're all about dignity today. So my mom wears this. This is what she wears. Like I said, blue means back, so we know how it fits. And she wears these every day. She doesn't complain about it. She says, I've asked her how she feels about them. She said that she really can't tell. It's just like any other underwear. I have seen these in every state of use, in all honesty, and they really do a great job. So now, the other thing is these pads are very sticky. Once they get in that pull-up, I'm gonna tell you that if you try to say, oh, the pull-up is fine, it's just the pad, let's take the pad out and put a new one in. No, it's not going to work that way because I tried it one time. And when you go to pull the pad out, it rips that inner liner of the pull-up, and it's not, and that pull-up's not going to do its job anymore. You've ruined it. So you got to make sure that you have them ready. I always make sure that she has at least 4 to 5 a day ready to go. Not that she's using 4 or 5 a day. That's not the case. She does use the toilet. She's able to go. But if she needed, she has 4 or 5 a day. So I make sure she has about 35, so yeah, 28 to 35 of these pull-ups put together, ready to go at all times. Like I said, I have them sent to my house and I do them when I'm at home. I literally put them all together while I'm watching TV, and I put them in a bag. And when I go to her house or her apartment, I put them in her bathroom cabinet. And also, she has a box of them in her armoire with her clothes. So we have two locations where we keep them. And I think they've been really great and really helpful. So, like I said, so we have, I want to say this brand, this TENA brand, they really do try to, their specialty is real. They really do try with incontinence care. If you have these pull-ups on, they don't have tabs. You're like, what do I do? I need to take them off my loved one in a real quick. Guess what? I'm not going to do it because I'm going to use this one, but you can rip it. It just rips right off. And when I help put this on my mom, I give it a little pull up the backside, and it really does hold. As you can tell, it's not ripping. I help get that up her backside, and it's really great. But yeah, if you have to get this off a loved one, especially if they're asleep or laying in bed, you can rip it on the sides, and then that way you can easily roll your loved one side to side to be able to get it out from underneath them. So that you don't have to worry about just taking it off like regular underwear. You can rip the sides and it will work. So we have that. It's breathable. So this is it. And they have many different little, so if you go to their website, they've got a lot of different liners, pads, all the things they have. They can tell you what to use the best. I have tried the pads from this brand and they're good, but I have just found that this brand just works just better just for my mom. I don't know. Like I said, because it's not bulky, it's nice and large. It holds a lot of liquid, and it doesn't add that bulk. It just fits right in nicely, and it's not bulky and makes my mother uncomfortable. So, like I said, that's why I picked this. It's a combination. Like I said, I've tried other brands that have been on TV. They just didn't work for my mom. They're pretty. I don't know. They're pink. They have flowers. Okay, fine, whatever. But they need to do a job, and if they're not doing the job, I'm not going to buy it. So I have these sent to me online, like I said, through auto ship. I set it up. So I get them every. This one I get in packs of 4. So I have 48 of these on hand. So that's pretty good. Like I said, she doesn't use 48 and she doesn't use 35 in 7 days. She uses less. And so sometimes I can buy these and get maybe 3 to 4 weeks out of them, which is really great. And so they come to me that quickly. And then also with these, we've had a little bit of a backup because yet again, she didn't need the pull-ups as often. So I didn't use as many of these pads. And these I also get sent to me in packs of 3. So I always have 60 of these on hand at any time. And I have these sent to me probably every 5 to 6 weeks. So that kind of gives you an idea for my mom, what I'm looking at. So I really hope that helps. I hope remember, let's recap. You take the pull-up out of the package, you want to stretch it, you want to open it, get it ready for your loved one. Turn it inside out. If you're going to add a pad, turn it inside out. Then open the pad up, start at the top in the front, and push it all the way down through the back so it fits nice and tight and is not loose. See, as you can tell, it's very sticky. It stays, I'm pulling, it's very sticky. So it really does stay in place. It doesn't bunch up. It doesn't come loose. And then you turn it right side out, and then I fold it back up just like this. And I put them in her bathroom just like that, right in there. She's all ready to go. All the girls are able to find them. I'm able to find them. She can find them if she needs it. So I hope that really helps you. And maybe know that if just a pull-up is not working, there are things you can do, like adding the booster pad to make it work better for your loved one so they have dignity throughout the day. All right. The song of the week is going to be Serotones, Good Day. The band is called Serotones, and the song is called Good Day. It's got a great little groove, and I love the line roller skating over the haters. Who doesn't love a line like that? That's right. Have a great day. Make yourself feel good. Um, you are worthy to be loved, and being loved is free. So know that you've something you can give to somebody else, and just have a really great day. Okay. So thanks again. Serotones, Good Day. I really appreciate y'all listening, and I hope you find some really nice products for your family. Okay. Love you guys. Bye. Thank you so much for listening to Sandwich Stories. I really hope you learned some new things and enjoyed it. If you did, tell a friend, tell your mom, tell your sister, tell your dad, tell everybody you know to also listen. Maybe they'll learn some new things, how to help each other out, and find us at Sandwich Stories Podcast. Thanks so much.